5 steps target recovery for a whiplash injury. It's wintertime here in Michigan. The roads are slippery, and none of us want to get in a whiplash. None of us want to be rear-ended. Most of the things that you've been told about a whiplash recovery is actually holding you back from a full recovery. When I say full recovery, we want long-term pain relief, we want full flexibility, and we want your spine to be strong and stable so you can do the things you want to do. The problem is most people only focus on pain relief. And you know what? Drugs and alcohol take care of pain, but we all know there's side effects to that. Now, some of you might need some temporary pain meds, and I get it, but that should only be for a very short period of time. The real key to a permanent recovery isn't just reducing pain, it's restoring proper alignment, proper function, and proper stability of your spine, especially if there's ligament damage. Now, if you saw my last video, the ligaments are the support structures that hold you in alignment. That's the most common thing that's injured in an accident. It's often missed, all right? So there's 3 things that can happen when you injure your spine. 1, you could have a fracture. 2, you could have a support ligament injury. Go back to my last video, I cover that pretty much in detail. And the 3rd is a disc. A disc you diagnose with an MRI. Now, after 30 years of helping patients fully heal from serious spinal injuries, I've identified 5 crucial steps that make all the difference in the world. In this video, I'm going to show you exactly what to look for, what I think is a comprehensive, evidence-based whiplash treatment plan. So you don't waste your time on solutions that don't work. Let's dive in. Again, most things we've been told are keeping us back. When you only focus on pain relief, again, we don't get key recovery. I'm Dr. Gregory Kramer. I have over 33 years of clinical experience and certification in chiropractic biophysics. Chiropractic biophysics is the #1 structural rehab technique in the world. There is the most research behind it, it is the most evidence-based, and it's the most common sense. I specialize in treating chronic health problems, like a chronic whiplash, and also acute whiplash, chronic L4, L5 disc herniations, chronic peripheral neuropathy, chronic knee problems. Today's video, we're focusing on whiplash because it's wintertime here in Michigan and it happens all the time. Now, what do I use to help people? Well, I use a variety of corrective methods. I use things like mirror image adjustment, exercise and traction, and spinal decompression to decompress compressed disc and nerves, which is fantastic for neck pain, back pain, pain radiating down your arms and legs, and neuropathy. I also use a lot of targeted exercises, and we're going to cover that today, how to be specific based on your own unique x-ray evaluation. Now, before I continue this video, I would like you to hit that subscribe button if you want to learn how to eliminate pain, avoid surgery, stabilize your spine so you can live stronger longer. All right, so this is the 5-step recovery plan after a whiplash. Here's a research paper by Dr. Evan Katz. And basically, a traumatic whiplash injures the ligaments that causes the curve of the neck to reverse. That's called a kyphosis. And the bottom line, that leads to bad things. That leads to increased pain, pressure on the nerves, pressure on the spinal cord, pressure on the joints, bad outcome. And so the research page basically says the shape and alignment matters. Now let's take a look at some of patients of mine. This is an example. The blue line is normal. That's where a normal curve should be. Well, after a trauma, we injure the ligaments, and guess what happens? This is far from normal. This is a severe. Now, what kind of problems would this person have? Well, go figure. Neck pain, pain going down the arms, headaches, dizziness, and many times you can have pressure on the spinal cord, and that can affect even below the neck and below the arms, sometimes into the feet. We started specific adjustments. We're targeting our force. This is not a general manipulation that you see on YouTube. We target the force, as you can see this aerial, with adjustments, with corrective exercise, which I'll demonstrate in a second, and with traction, which is molding the spine in and out of the office. So take a look at this, look at how far this is from normal, and then this is the post x-ray. This was in 2 to 3 months. This is a huge change. Now, it's not perfect. The patient had to move. However, I believe we could get even closer. So this is an example of correcting of the spine, outcomes, pain relief, better strength, better mobility without drugs and surgery. This is another example. As you can see, the blue line is normal, the yellow line is the individual patient, far from normal. What does this person have? Again, headaches, neck pain, dizziness, arm pain. We put the arrow, this is where we're targeting with adjustments, exercise, traction, and here's the post. As you can see, perfect alignment on top. We still got some work to do here. And I'm going to show you one other example. Yellow line, this is called a buckle. It's a reversal of the cervical curve. Again, what do they have? It's a common theme. Headaches, neck pain, dizziness, numbness in the fingers, loss of grip strength. And through adjustments, exercise, and traction, what do we have? We have a more normal post x-ray. So alignment matters. All right, now this is a motion x-ray. So the test that I recommend after a trauma, absolutely guaranteed, would be a motion x-ray. That's an x-ray where you stand still, bend your head forward, bend your head back. We want to stress the ligaments and see what happens. Right here we have excessive motion. This is ligament damage. Right here we have normal motion, okay? Now compare that to the next film. This is what we call a locked vertebrae. So right here, and visualize each vertebrae like a link in a bike chain. And if you bend a normally functioning bike chain, a well-oiled bike chain, every segment should move a little bit. It shouldn't be a kink in the chain. Well, if this were a chain, you can kind of see there's a kink right where I have this arrow. Then we get motion, and then between these two vertebrae, this is the back of your skull called your occiput, and this is your atlas. Now this is a tremendous area that's often locked up, and there's a huge amount of nerve endings in the top of your skull. So basically, just as you would expect, the closer you are to the brain, there's going to be more concentration of nerve endings in the muscles in the back of your head than, let's say, your feet. So this is an area we would target with adjustments, exercise, and traction. So let's look at what we can do for ourselves, all right? So number one, we would say if this is a locked vertebrae right above this bump, we would take this knob on this is called a theracane, and I'm going to put it right where the vertebrae on the one side of the spine, and I'm going to put some pressure, and I'm going to move my head. Flexion, extension, flexion, extension. I'm going to move my head side bending right and left, and I'm going to rotate right and left. Now look where I am. I'm just off the spine, and I'm going to do it on the other side of the spine. So I'm going to be on each side of the spinal segment. Same thing, 6 ranges of motion. Flexion, extension, right bending, left, and right. And I would probably do 10 to 20 reps on each side to warm up that area. Afterwards, what I would do is, now I'm going to apply this band. We're going to target this area to increase the strength, flexibility, and alignment. Strength, flexibility, and alignment. And I'm going to put some pressure. I'm going to hold it for a few seconds. And then I'm going to hold the extended position for about 10 seconds. Now remember, no exercise should hurt you. Nothing should cause blurry vision. Nothing should cause dizziness. Nothing should cause pain going down the arms. Stop if you have any trouble with that. Okay, again, these exercises are prescribed by a corrective care chiropractor. And so again, we're targeting this area. And very simply, we're going to do that for up to 5 minutes. That's right. 5 minutes. And now we're ready to do some molding of the spine with home traction called a Denneroll. Now, before I show you home traction, think of traction as a long adjustment. We're putting pressure over time, kind of like putting braces on teeth. We want to influence the holding elements, the ligaments. Now remember, the first 30 days of care is different than the next 60 and the next 90. So whether it's an acute injury or chronic will determine the type of treatment. Everything I show you has already been screened by your doctor. It's already pain-free, and it's a progression of your spinal rehabilitation. The next video, I'm going to demonstrate the first 30 days, the next 30 days, and so forth, what we do for pain relief into spinal correction. This is a full spine correction for an individual that has loss of the curve and not enough curve in the mid-back, and the rib cage is shifted forward. This is an example of three-dimensional spinal correction. This is another example of two-way traction. So how far the head goes back depends on the patient tolerance. If it hurts you, we don't go back that far. So we are literally distracting the skull. This feels really good for most people. And then we're applying a force to reshape the spine. This is called two-way traction. Again, we start off at 2 minutes, make sure it's comfortable, and then we gradually build up to about 20 minutes. This is another example of two-way traction. All right, we're applying forces to reshape the spine. So what are the 5 components? We target the locked vertebrae with spinal adjustments. Some adjustments are done by hand, some with an instrument. The adjustment moves the bone, it unlocks the vertebrae, takes pressure off the nervous system, it calms the nervous system, and it sets the stage for healing. We then do strengthening exercises, which I'm going to show you. We then do proprioceptive exercise, things for balance. And then we mold the spine with traction. And then the last thing is we try not to be stupid at home. So let's not injure ourselves. Let's not do contact sports too soon. Let's not look down on a computer. Let's not have pillows pushing our head down. Let's keep a neutral spine most of our day, not down, not up. Well, so when we work and when we play, we're keeping a neutral spine. So again, we've shown adjustments, exercise, traction. This is the in-office traction, and now I'm going to demonstrate what you can do at home. So this Denneroll is similar to what this individual patient is using, except this is something you would use at home on a hard surface. This is doctor prescribed. There's typically 3 positions. You put them in your neck, and they're all based on your own unique x-ray procedure. So some people it's upper, some people middle, some people it's lower. I'm going to demonstrate C6 level. You put it down, you lie, and you lie on it. And when you get up, you move it out of the way. So again, your doctor will show you where to put it. You've got to warm up. So think of your spinal ligaments like plastic. You need to warm it up before you mold it. Nothing should hurt you. It takes a few times to learn where to put it. So most offices, you'll set it up a few times in the office. Make sure you get it right. You'll progress. And then eventually, once you're cleared and you know how to set yourself up, you'll do that at home. This is a game changer for chronic whiplash, for eliminating pain, restoring mobility, improving alignment, so you can go back to doing all the things you want to do. Now remember, healing doesn't happen in the clinic. Healing happens at home. Healing's between you and God. What I'm doing is create an environment for healing. So again, we want to eliminate pain, normalize movement, strengthen the spine, and improve alignment. Alignment matters. And the sooner we do it, the better. The longer you leave something injured, the more scar tissue forms. Scar tissue is like gristle in a cheap cut of meat, and the harder it is to correct. So again, pay attention to what you do when you leave the office. Make sure your headrest in your car is at the top of your head and close to your head. Make sure your pillow is not pushing your head forward. Make sure when you're on a computer, you're looking straight ahead. Give your body a chance to heal. Don't use vigorous exercise right away. So rehabilitation is different than competitive exercise. So recovering from a whiplash injury many times is frustrating. You're not alone. It takes time and repetition. So obviously people struggle with pain, instability for a while, but don't lose hope. Give your body a chance to heal, okay? And with the right approach, you can regain the strength, eliminate pain, and maintain a pain-free life so you can go back to doing all the things you want to do. And if you're not sure whether you've had a full structural or motion evaluation of your neck, make sure you watch my previous video where I talk about a special test that helps determine ligament damage. This test is a game changer. It will guide what you do in the office. It'll guide your rehab. It'll guide where and how to adjust. And it'll also guide what you do at home. I'll link the video in the description below. If you find this video helpful, do me a favor, like it and share it so more people can find the right path to recovery. If you have any questions, drop them in the comments. I read them all and I'm here to help. The next video you need to watch is whiplash injuries, causes, symptoms, and corrective treatment. Go click on it right now.